Important confusing multiple choice questions of physiology. Number 1. 2-year-old boy brought to emergency with frequent loose stools, abdominal pain, fever, and vomiting. Eyes are sunken, tongue is dry and coated. Which of the following explains the condition? A. Cellular swelling. B. Decreased ADP production by the cells. C. Decreased extracellular fluid volume. D. Decreased calcium ion concentration in extracellular fluid. E. Dehydration. Correct is dehydration. Number 2. Electrocardiogram of the patient with electrolyte disturbance shows prolonged PR interval, inverted T wave and prominent U wave. He has A. High K concentration, B. Hypercalcemia, C. Hypokalemia, D. Low plasma calcium, E. Low plasma sodium. Correct answer is hypokalemia. Number 3. Arterial baroreceptors in the carotid sinus and arch of aorta. A. Are located in tunica media. B. Help maintain arterial BP. C. Respond to change in partial pressure of oxygen. D. Send impulses to brainstem only through vagus. E. Undergo adaptation within seconds. Correct answer is help maintain arterial BP. Number 4. As a result of simultaneous injection of small volume of water into the carotid artery, an hemorrhage of up to 12% of total blood. A. Aldosterone secretion is inhibited. B. GFR is increased. C. Urinary sodium excretion is increased. D. Urine osmolarity decrease and flow rate increase. E. Urine osmolarity increase and flow rate decrease. Correct is urine osmolarity increase and flow rate decrease. Number 5. PR interval in ECG. A. Becomes abnormal in heart block. B. Includes the PR segment. C. Includes the wave of atrial depolarization. D. Represents atrial depolarization and conduction through AV node. E. Represents the interval between the atrial contraction and the ventricular contraction. Correct is PR interval in ECG becomes abnormal in heart block. Number 6. SA node. A. Has membrane potential of -65 to -80. B. Controlled by autonomic nerves. C. Less permeable to sodium. D. Is located in right atrium on the septum. E. Spontaneously generates impulses. Correct is spontaneously generates impulses. Number 7. Cardiac index. A. Increases with the heart disease. B. Is cardiac output per square meter of the body surface area. C. Is percentage of end diastolic vol ejected during systole. D. Is the total amount of blood ejected by both ventricles. E. Normal value in young male is 5.5. Correct is cardiac output per square meter of the body surface area. Number 8. QRS complex has properties except A. Comes after P wave. B. Consists of positive and negative waves. C. Has variable amplitude in different leads. D. Is due to atrial depolarization. E. Occurs just before the vent systole. Correct option is due to atrial depolarization. Number 9. The common denominator in various forms of shock is A. Arteriolar relaxation with subsequent loss of peripheral resistance. B. Blood loss. C. Circulating blood volume less than the size of intravascular volume. D. High hematocrit values. E. Reduction of plasma volume. Correct is circulating blood volume less than the size of intravascular volume. Number 10. Cardiac muscles are functional syncytium because they have A. Actin and myosin filament, B. Gap junctions between adjacent cells, C. Larger T tubules, D. Slow calcium-sodium channels, E. Transverse striation. Correct is gap junctions between adjacent cells. Number 11. The most common early manifestation of transfusion reaction is A. Allergic, B. Febrile, C. Hemolytic, D. Urticaria, E. Vasovagal. Correct is patient becomes febrile. Number 12. In normal healthy person the second heart sound A. generates vibration in ventricular wall during systole, B. has a duration of 0.14 seconds, C. caused by ventricular filling, D. normally has low frequency, E. occurs during isovolumetric relaxation phase of cardiac cycle. Correct is second heart sound occurs during isovolumetric relaxation phase of cardiac cycle. Number 13. Atrial flutter. A. causes a very rapid rate of contraction of atria. B. follows by 4 to 5 beats of atria for every beat of ventricle. C. is a condition caused by circus movement in the atria. D. lead very high volume of blood pumped by atria. E. shows P wave which is very weak. Correct is atrial flutter is a condition caused by circus movement in the atria. Number 14. Following help in non-progressive compensatory shock except A. angiotensin, B. baroreceptor reflex, C. CNS ischemic response, D. increased sympathetic reflexes, E. stress compression of capillaries. Answer is stress compression of capillaries. Number 15. A patient complains of generalized weakness and palpitations. Pulse is irregular. ECG shows absent P waves. QRS complexes are normal but with irregular intervals. Diagnosis is AAV block, B. atrial fibrillation, C. atrial flutter, D. SA block, E. ventricular fibrillation. Correct is atrial fibrillation. Number 16. An unconscious patient with cold clammy skin and rapid pulse. He is pale. Mean arterial blood pressure is 50 mm of mercury. At this stage the mechanism providing maximum compensation is A. baroreceptor mechanism, B. brain bridge reflex, C. CNS ischemic response, D. chemoreceptor reflex, E. volume reflex. Correct is CNS ischemic response. Number 17. The systolic BP is highest at A. aorta, B. central vein, C. pulmonary artery, D. renal artery, E. right atrium. Correct option is renal artery. Number 18. Chronic pressure overload on left ventricle due to aortic stenosis result in A. altered left ventricular distensibility, B. decreased contractility, C. ejection fraction 60%, D. end diastolic volume 230 ml, E. left ventricular dilation. Correct option is decreased contractility. Number 19. An 18-years-old female with history of rheumatic heart disease comes with dyspnea. Examination shows mitral regurgitation. Most probably the murmur will be A. ejection systolic in aortic area, B. ejection systolic in pulmonary area, C. machinery at left sternal edge, D. pansystolic at apex beat area, E. systolic at tricuspid area. Correct option is pansystolic murmur at apex beat area. Number 20. A pregnant lady develops severe breathlessness. On examination, her pulse was irregular. She had a mid-diastolic murmur. Most appropriate investigation will be A. Constant RR interval, B. Globular heart shadow on X-ray, C. P. mitral on ECG, D. RVH on ECG, E. Raised pressure gradient across mitral valve. Correct answer is raised pressure gradient across mitral valve. Number 21. A 50-year-old man presented with the 1 hour of chest pain, sweating and breathlessness. Most appropriate investigation will be A. CKMB, B. CPK, C. LDH, D. SGOT, E. TROT. Correct option is A. CKMB. Number 22. The AV nodal delay is A. Affected by stimulation of autonomic nerves to TH heart, B. Because of the slow conduction, C. Due to activation of slow CANA channels, D. Due to less No of intercalated discs in AV node, E. Imp because it allows the atria to complete their contraction before the ventricles begin to contract. Correct option is E. Imp because it allows the atria to complete their contraction before the ventricles begin to contract. Number 23. The mean arterial blood pressure. A. Decreases in old age. B. Equals the diastolic blood pressure plus 1/3 of pulse pressure. C. Is normally about 80 mmHg. D. Is difference between systolic and diastolic BP. E. Is the value halfway between systolic and diastolic BP. Correct is equals the diastolic BP plus 1/3 of pulse pressure. Number 24. The most characteristic ECG finding showing MI is A. Deep and wide Q wave, B. Elevation of ST segment in the leads overlying the area of infarct, C. Peak T waves, D. Prolonged PR interval, E. Prominent P wave. Correct is elevation of ST segment in the leads overlying the area of infarct. Number 25. The carotid baroreceptors. A. Are located in carotid bodies. B. Discharge at increase rate when arterial BP rises. C. Receives sensory innervations from vagus. D. Show decrease rate of discharge with carotid massage. E. Undergo adaptation within minutes. Correct option is B. Discharge at increase rate when arterial BP rises. Number 26. Cardiac reserve. A. Decrease in athletes. B. Increase in vitamin deficiency. C. Increase in ischemic heart disease. D. Is the cardiac output per square meter of the body. E. Is the maximum percentage by which the cardiac output can be increased above normal. Correct answer is the maximum percentage by which the cardiac output can be increased above normal. Number 27. Cardiac output is not decreased in A. Acute venous dilation, B. Beriberi, C. Cardiac tamponade, D. Myocardial infarction, E. Venous obstruction. Correct option is B. Beriberi. Number 28. 45-year man presented with sudden onset of retrosternal chest pain with sweating and breathlessness. On examination BP was 90/60ths, and pulse was 110 per minute, low volume. Most likely diagnosis is A. Dissecting aneurysm, B. Myocardial infarction, C. Pneumonia, D. Pulmonary embolism, E. Tension pneumothorax. Correct option is myocardial infarction. Number 29. 25-year-old lady presented with dizziness and blue discoloration of extremities for 2 days of duration. On examination, cyanosis of lips and extremities is present. Systemic examination is normal. Most appropriate investigation is A. Arterial blood gases, B. ECG, C. Echocardiography, D. Spectroscopic examination of hemoglobin, E. X-ray chest. Correct option is D. Spectroscopic examination of hemoglobin. Number 30. The first heart sound is produced due to vibration of A. Closure of AV valve at the beginning of ventricular systole, B. Coarctation of atria, C. Contraction of ventricles, D. Flow turbulence in aorta and pulmonary artery, E. Opening of semilunar valves. Correct option is A. Closure of AV valve at the beginning of ventricular systole. Number 31. 40-year male patient presented with chest pain for 30 minutes, ECG shows ST segment elevation in lead 2, 3, AVF. He is suffering from A. Anterior wall MI, B. Anterolateral wall MI, C. Anteroseptal MI, D. Inferior wall MI, E. Posterior wall MI. Correct option is inferior wall myocardial infarction. Number 32. In cardiac valve lesions, angina pain is most common in A. Aortic regurgitation, B. Aortic stenosis, C. Mitral regurgitation, D. Mitral stenosis, E. Tricuspid regurgitation. Correct option is B. Aortic stenosis. Number 33. In cardiac cycle, the first heart sound occurs in A. Atrial systole, B. Ejection phase, C. Isovolumetric contraction, D. Isovolumetric relaxation, E. Rapid inflow. Correct option is C. Isovolumetric contraction. Number 34. Most important cause of decreased voltage of QRS complex is A. Atrial fibrillation, B. Atrial flutter, C. Bundle branch block, D. Mitral stenosis, E. Old MI. Correct option is old myocardial infarction. Number 35. For long-term control of BP, the role of one of the following is vital: A. Brain, B. Heart, C. Kidney, D. Liver, E. Lungs. Correct option is C. Kidneys. Number 36. If a patient is having low cardiac output, he is most probably having A. AV fistula, B. Anemia, C. Beriberi, D. Hyperthyroidism, E. Obstruction of IVC. Correct option is E. Obstruction of IVC. Number 37. During the measurement of cardiac output, the dye used during the indicator dilution method is A. Cardio green, B. Congo red, C. Evans blue, D. Gentian violet, E. Potassium dichromate. Correct option is A. Cardio green. Number 38. First heart sound. A has a duration of 0.11 second. B has a high pitch. C has a very high frequency. D is due to closure of aortic valve. E occurs in isovolumetric contraction phase of cardiac cycle. Correct option is B has a high pitch. Number 39. Heart becomes extremely flaccid and dilated with slow heart rate due to increase in A. Calcium ion in ECF, B. Lithium in ECF, C. Magnesium in ECF. D. Potassium in ECF. E. Sodium in ECF. Correct option is D. Potassium in ECF. Number 40. Cardiac muscles cannot be tetanized because A. Action potential with plateau. B. Gap junctions. C. Long duration of contraction. D. Long refractory period. E. Property of automaticity. Correct option is D. Long refractory period. Number 41. A person is having atrial rate 200 to 350 per min. 3. 1. Avenue block and sawtoothed shaped P wave in ECG. He is having A. AV nodal paroxysmal tachycardia. B. Atrial fibrillation. C. Atrial flutter. D. Complete AV block. E. Ventricular fibrillation. Correct option is C. Atrial flutter. Number 42. A patient shows progressive prolongation of PR interval in successive heartbeats, followed by a drop of beat. He is most likely having A. Atrial flutter. B. Complete AV block. C. First degree AV block. D. Mobitz I block. E. Mobitz 2 block. Correct option is D. Mobitz 1 block. Number 43. Stimulation of sympathetic nerves to the heart produces A. Decrease in conduction velocity through ventricles. B. Decreased coronary blood flow. C. Decreased stroke volume. D. Hyperpolarization of SA nodal fibers. E. Shortening of AV nodal delay. Correct option is E. Shortening of AV nodal delay. Number 44. During exercise the coronary blood flow increases because of A. Increased arterial BP. B. Increased heart rate. C. Parasympathetic inhibition. D. Release of vasodilator metabolites in the myocardium. E. Sympathetic stimulation. Correct option is D. Release of vasodilator metabolites in the myocardium. Number 45. In patients with cardiac failure, edema results from increased formation of interstitial fluid. It is due to A. Decreased arterial BP. B. Decreased plasma colloid osmotic pressure. C. Increased capillary permeability. D. Increased capillary pressure secondary to increased venous pressure. E. Salt and water retention by kidney. Correct option is D. Increase capillary pressure secondary to increase venous pressure. Number 46. Regarding coronary circulation, all of the following are true except A. Arteries can develop collaterals. B. Exercise causes vasodilation. C. Most of the blood flows during diastole. D. Under resting condition the blood flow is 750 ml per minute. E. Vasodilation occurs in tachycardia. Correct option is D. Under resting condition the blood flow is 750 ml per minute. Number 47. Atrial fibrillation is characterized by A. Sawtooth appearance on ECG. B. Increased cardiac output. C. Multiple P waves preceding QRS complexes. D. Pulsus deficit. E. QRS complexes occurring regularly on ECG. Correct option is D. Pulsus deficit. Number 48. Stroke volume is increased in all except A. Administration of digoxin. B. Infusion of dopamine. C. Intake of caffeine. D. Parasympathetic stimulation. E. Stretched cardiac muscles. Correct option is D. Parasympathetic stimulation. Number 49. During rest in a well-trained athlete there is increase in A. Arterial BP. B. Cardiac output. C. Heart rate. D. Stroke volume. E. Sympathetic activity. Correct option is D. Stroke volume. Number 50. Aortic regurgitation is characterized by A. Bounding pulse. B. Capillary pulsation in nail beds. C. Early diastolic murmur. D. Femoral brute. E. Heaving apex beat. Answer stay controversial. Most probably C.